Since junior high until about a month and a half ago, there was not one day that went by unless I stayed in the house that I was not made fun of for being fat.
My weight was fairly well controlled until my sixth baby. Discovered I had gestational diabetes, gained 125 pounds with the pregnancy. Very overweight, very sick.
I remember before my surgery being invited by my son to his school for the father-children flag football event. There's nothing worse than being more than 100 pounds overweight, trying to run around the field with flags attached to your hips, chasing these little tiny kids.
I have no recollection of ever being anything but fat.
For over 97 million Americans who suffer from obesity, the consequences can be devastating.
I became very sick, was diagnosed with diabetes, was taking 3 and 4 insulin shots a day, 2 pills every morning, 2 pills every night, also for diabetes. Had sleep apnea. I'm on a CPAP machine with 6 liters of oxygen every night. Had high blood pressure, had tachycardia, 3 leaking valves in my heart.
The heralding event for me was waking up with the esophageal reflux one middle of the night. The acid had washed into my lungs. I could not breathe. I got out of bed gasping for breath, just literally could not move air, and was close to passing out before I finally was able to catch my breath. That was an event which was sort of a significant decision-making event for me.
But there is hope. According to the National Institutes of Health, the NIH, weight loss surgery for the morbidly obese, when combined with behavior modification, is currently the most reliable and only choice for long-term maintenance of excess weight loss. In this video, you will learn about weight loss surgery. You will hear from patients who have undergone the procedures and from doctors who perform them. You'll hear about the remarkable success rate for weight loss surgery, as well as the risks and complications that accompany the procedures discussed. What does it mean to be morbidly obese? Let's start with obesity. Obesity is defined as an excessive amount of body fat. If an individual is 20% over ideal body weight for his or her age, sex, or height, they are considered obese. Obesity is a disease that is out of control in the United States. As the second leading cause of preventable death, obesity has reached epidemic proportions. The National Institutes of Health reports that more than 1/3 of the adult population are overweight or obese. The impact of the disease, according to the World Health Organization, is so diverse and extreme that obesity should now be regarded as one of the greatest neglected public health problems of our time. According to the NIH, a morbidly obese person is someone who has reached a body mass index of 40 or greater. That is roughly equivalent to 100 pounds over ideal body weight.
I think you can categorize obesity into several segments. There is the ordinary type of obesity that affects many people but does not affect their health. And then we talk about morbid obesity, which is a very serious health problem with life-threatening ramifications in virtually every organ system in the body.
Body mass index, known as BMI, is a method of determining levels of obesity through a calculation based on weight and height. If by NIH standards you reach 20% or more above your ideal body weight, that excess weight becomes a health risk. An estimated 5 to 10 million Americans are considered to be morbidly obese, a situation that can lead to the development of significant obesity-related health conditions. What are obesity-related health conditions? Also called comorbid conditions, obesity-related health conditions are health problems that, whether alone or in combination, can significantly reduce your life expectancy. They may include, but are not limited to, diabetes, heart attack, high blood pressure, high cholesterol, heartburn, acid reflux, sleep apnea, respiratory disease, osteoarthritis of weight-bearing joints, depression, and infertility.
I really should get serious about my health because I know we got problems in my family. We all got a history of diabetes. We all got a history of high blood pressure.
Diabetes runs in my family. My family's Hispanic, and I have watched my relatives have amputations, have their hearts fail, have their eyes go blind, and that they died by the time they were 50 years old, and I'm 40 and I don't want to die.
Blood sugars were in the 400s and 500s, even with the insulin and the pill coverage. Was averaging 3 to 4 hours sleep a night, even with the CPAP machine. Just real sick, very sick. Looked about 9 months pregnant. Flushed all the time, heart rate in the 120s, even with the atenolol. Daily asthma attacks. Just a very, very sick person.
The risk of death from obesity-related health conditions such as diabetes or heart attack is 5 to 7 times greater than someone of normal weight. In fact, for individuals who are twice their ideal body weight, the risk of an early death is doubled compared to non-obese individuals. And while comorbid conditions threaten your health, your well-being, even your life, the social impact of morbid obesity can be devastating, both to the individual and to their loved ones. Comorbid conditions can disrupt relationships, restrict your mobility, and keep you from performing even the basic activities in life.
The social impact is one of the things that I see quite a bit because these patients are social outcasts, or at least they feel that they're social outcasts.
It's kind of like depressing when you see everybody else getting help when you go in the store and you're big. People kind of like ignore you or look the other way.
The social impact of morbid obesity is incredible. The level of discrimination in our society, from simple things such as separate stores for clothing, to the statements made to people who are shopping in a grocery store, to the difficulty with buying an automobile or fitting on in a public arena, such as a theater seat or a sports stadium seat. All of these things affect you and gradually take away your sense of self-worth, your sense of importance in society.
I didn't like going out in public because people staring, you know, look at this thing that's coming this way, look at the size of her, you know, she needs to just quit eating type thing, especially when you'd go out to dinner and you'd sit down and you would eat dinner. You know, people would say that's how she got the way she is because she's eating and constantly eating.
Often the victims of society's prejudice against obesity are made to feel personally responsible for their condition. The truth, however, is far more complex, and one fact stands out. Obesity is not simply the result of overeating or a lack of willpower. Research has shown that a significant underlying cause of obesity is genetics.
There's a genetic component to morbid obesity. Certainly we look like our parents, and if we have people in our family that are morbidly obese, we're more likely to have that. We have the genetic background for that.
There is a genetic basis for morbid obesity, and that some people just turn more of their calories into fat, whereas other people turn more of their calories into energy and heat.